So again, good morning and welcome to our information session for the National Tollman Lettering for LASA, or we call them LASA, Look Alike, Sound Alike Medications. So today, part of the information session is also a brief overview of NETA. So my name is Carissa. I am one of the nurse educators in NETA, and I am the education manager for NETA. So before I begin, I'd like to acknowledge the traditional owners of the land where I work and live, and also for those who are attending who are in Australia today. Also would like to acknowledge the elders past, present, and emerging. So welcome to today's information session. Renu, I know that you are taking our online class in OSCE. Have you heard about the National Tollman Lettering for Look-alike, Sound-alike medications?
Yes, yes,
Yes.
actually, look alike. Yep.
Yeah, perfect. So today will be an overview of this topic, but also we will be doing some case study presentations as well. So joining us as well is Jacqueline. So probably we'll wait till Jacqueline gets connected and then we will start. Jacqueline is just on time. She's still connecting to her audio though. Anyway, we'll keep going. So, so the National Tollman Lettering for LASA would probably be a new term for majority of the international students. Would you say that this has been, or this is a new term for you as an international student, Renu?
Yes, actually, it was new. I got to know from the online classes.
Yeah, so in our online classes, we do discuss about the National Tollman Lettering. Jacqueline, welcome to the information session. Just wanted to cross-check, double-check, triple-check if you can hear me, Jacqueline.
Yes, I can hear you.
Okay.
Thank you.
Thanks, Jacqueline. So again, today we'll be doing a National Tollman Lettering. Jacqueline, if I may ask, which country are you registered?
I came from the Philippines
All right.
and I'm here in Australia now.
Perfect. Okay, I'm not sure if that is your internet connection or mine, but you sound a bit very lagged and very slow. But yes, I did get that. You are registered from the Philippines and you are now in Australia. So majority of the international nurses will find that the National Tollman Lettering is a very new term, and also the LASA, but they are the look-alike, sound-alike medications. So just a quick fast facts about NETA. So NETA is the leading outcome-based assessment course provider. And we say that because we are proud that NETA has the highest number of successful NCLEX and OSCE candidates. In fact, we already have 11 nurses who completed the whole OBA program and are now registered nurses. We are now in the RN Kickstarter program for these nurses. We are providing them support for them to be able to get the job that they want. So to all of our students who will complete the OBA program, this is something that will benefit you so that you will be able to get the job that you want or get selected for the job that you have applied for. We are very student-centered, people-focused, and outcome-oriented. And when we say that, we focus the learning for our students, and our educators are very passionate in making sure that our students actually understand and will pass the test. Because again, we are outcome-oriented, we want results. So it's not just getting the students to come on board, it is actually making the students get successful, and we will tick your goal. So you've got a tick box there, your what do you call this, your goal tick list. We will help you tick that as well. So we are very outcome oriented. That means we really want results. These are just a number. Renu, are you here for NCLEX? I'm not sure, but I know that you were one of the NCLEX classes as well. Now you're doing OSCE. But
Yeah.
these are you here, Renu?
It's actually I did pass from NETA, but I think I'm not in this page.
You're
That's all.
not in this page. I'm so sorry.
That's
We
okay.
just couldn't fit everyone here, but what the message of this slide is that we want you to be one of these successful students. And the reason is because I know that that is your dream to become a registered nurse, which was my dream as well before. And we really want to celebrate your success. So we want you to be one of them. And again, we can't fit all of our successful RNs, but Renu and Jacqueline K, this will be you in the future. We can search you in the upper register. You can search your educators if you want to. If you look into the details, you can also see there everything about the registration, from the time as to when they were first registered, the country where they have registration, or even the languages that they speak. That's very interesting as well. The number of experience that they have in Australia as well. So it is very important for you to get the proper information as well of your educators, because you really want to know who are teaching you. You can see that as well in our websites. If you go to nursingeta.com and you go to our team under About Us, you can also see the names of your educators. So if you have free time, go and search for your educator's name in there. It's quite interesting. These are our students who actually completed the OBA process. So yes, we do have products. As I said, we are very outcome oriented, very result focused. So we really want you to be part of this in the register. This is your goal, isn't it, Renu and Jacqueline? You want to be part of the upper register?
Yep.
Yes, so you will be like them. The pictures here are actually not there in the register. We just put the pictures there just to add a little bit of color. This is how we conduct the OSCE. It's both learning and fun. We believe that if you feel psychologically safe in where you are learning, we believe that there will be a lot of learning. So as much as we want to give you all input, we also want you to have some fun during your OSCE, because we really want you to retain those information in a very psychologically safe environment. So one photo here, this one, where my mouse cursor is, this is in Sydney, with our nurse educators Jenny and Ross, and this one is in I think in Queensland. This one is in Adelaide, this one is in Melbourne, that's also in Sydney, this one is in Adelaide, and that one is in Melbourne. So we do provide the OSCE face-to-face in those areas. Another fast facts is that we in NETA, we really focus on our vision, our mission, and most importantly, our values. So you can see here that our vision is that we will be the preferred OBA provider for IQNs, and we want 100% of all of our students to succeed in their OBA, and that is our mission. Our values is what we stand by in everything that we do in NETA. So as our students, we believe that everyone has the knowledge. We believe that everybody is already a university graduate in their home country. So we know that you are also registered nurses. The only difference is you're not registered nurses in Australia as of yet, but you are getting there, and that's why you are here. We provide support to everybody. It is very important that you know where to reach out when you need support. Our support is always there and always available. And also for students who don't reach out. It is actually NETA who actually reach out to these students. We respect that we are from different backgrounds, different culture, and also we respect that everyone should have the right to be able to learn in a psychologically safe environment. Everybody helps each other. So it's not just the educators helping each other or the students helping each other. It's all around, from the educators to the students and to the fellow staff that we have in NETA. So we work in teams within teams, and that's why we value teamwork. And lastly, we value transparency. We have been in your shoes as well. I myself is an overseas registered nurse from the Philippines, Jacqueline. I'm also from the Philippines, and I'm married to a Nepalese, by the way, Rinu. And that's why I have the heart and the love of both worlds, Nepal and Philippines. Um, so we value transparency because I have been in your shoes as well. I've gone through the complexity, the hard way of getting registration in Australia, and we want to guide you in a way that it's very truthful and in a way that is very transparent. So whatever you see from us in NETA is actually what you get from us as well. So for today's class, what is it for today? We will be tackling both NCLEX and OSCE, because if you can see in your NCLEX, Jacqueline, if I may ask, what are you looking at? Are you looking into NCLEX or OSCE?
Both. I
Both?
think I am now currently waiting for my ATT for NCLEX.
Ah, that's exciting. Reno's been there. And Kay, I know you're also looking for both NCLEX and OSCE. You're on mute. But anyway, so NCLEX and OSCE. So the Tollman, National Tollman lettering for both the NCLEX and OSCE is very applicable when you take the test. So there is a chat box, Kay, yes. So thanks, Kay. So the distribution of the content for the NCLEX test plan, there is 15% for pharmacological and parenteral therapies. So this is where your national Tollman lettering for look-alike, sound-alike medications would come from. Also in your OSCE, you can see that it goes in your medication administration. And in your medication administration, that could be a subcutaneous or intramuscular injection. That could be an oral medication as well. So on top of that, it is also very important in risk management in the clinical environment. And that is the reason why we have the National Tollman lettering, because it's to minimize the risk of medication errors. So it also belongs to the risk management. And there will be situations in your OSCE where you will be identifying risk and putting on plans and interventions to minimize the risk. And medication safety is one. So according to your national standards, I'm not sure if Reno would remember, medication safety, what standard is this in Australia, Reno?
Sorry, what was the question?
Your medication safety. Remember, you have your national standards that we have to follow as health
Yep.
practitioners in Australia.
Yes.
Would you remember that medication safety is part of the standards?
Yeah, it is fifth, sixth. I think among those standards where we are like looking for the medication safety, administration, adverse reactions, the
Perfect.
management of everything. Yeah.
Yes, so that is actually your standard 4. And for the information of everyone, in Australia, I know back home where I practice in the Philippines, I have not remembered that there is any standard. There might be, but it is not implemented appropriately, or it is not implemented across the board with registered nurses. In Australia, everybody knows the standards of practice, whether it is the national standards where medication is in there, or the NMBA registered nurses standards of practice. So it is all integrated and everybody knows this. And this is what APRA is testing you about when it comes to your OSCE as well. All right, so the National Tolman lettering and the look-alike, sound-alike medication, they are integrated in the medication safety because there has been a lot of medication errors, specifically the sound-alike medications. So you have here in the table, one is an intended medicine and the other one is a medicine that is received. So just a very quick just a quick question. Are these medications familiar to you? Aldactone, Azopt, Celipram, Daralin, Losec.
Yeah.
Are they all familiar? Yes?
I think Azopt
So
is not.
Azopt is not, because it is used primarily in the eyes. So probably that's the reason why it's not very familiar. But in this case, you can see here that the intended medicine is aldactone, which is spironolactone. But there has been a lot of errors that instead of aldactone, Altomet was given. Okay, there's Azopt. We call it Azopt. In I think America they say Azopt, but there are so many times that Atropt or Atropt has been given, and they are both medications for the eyes. So in so many instances, there has been medication errors here. We've got Celipram, which is an antidepressant. But in many cases, we are giving Celebrex, which is an anti-inflammatory medication. Then we've got Daralin, that is used for heart conditions. And in so many instances, Deptran is also given. And then we've got Losec. And in most cases, this happens as a verbal order. Of, is on, say there's an emergency call and then the doctor said, okay, just give Losec. They say, just give Losec. And then the nurse hears Lasix. And so they give Lasix. And there could be adverse effects with Lasix as well. So you can just see here that there has been a lot of errors with an intended medicine and the medication that has been received by the patient. So this is the reason why there is an implementation of the Tolman lettering. So I'm not sure if this is, again, I'm familiar to Jacqueline. Have you seen this document before, Jacqueline?
Not yet.
Not yet. And that is the reason why we're here in NETA, because this is something, if you look at the handbook of the OSCE, you can see there that there is an Australian Commission on Safety and Quality in Healthcare, which is #1 resource in the list that APRA has given you. So the National Tolman Lettering List was revised in December 2020. This has been a document in healthcare since 2013, I think, or 2012. And this document is widely used in Australia. So in NCLEX, you can also use this because of the look-alike, sound-alike medications. So let's go through this document. So the National Tolman Lettering, are you able to see that document?
Yes.
Yeah, it's quite a big document. Let's is that clear? So we will be discussing this in your class as well, but you can also see here that there are the list of medicine names that is paired with a Tolman that is applied. That's the caps lock. So you can see here Actonel and Actos, Acamine and Aclin. Okay, so these are like aldomet and aldactone. These are like the sound alike medications. And what you are expected in your OSCE is that you will know these medications if they have a look alike or a sound alike kind of medication, because you need to highlight that in your OSCE. The reason why you need to highlight is because that is how your assessor will increase the confidence in you that you actually know the Tolman or the National Tolman lettering. The atrop and azopt, which was given a while ago, but this is also bisoprolol and bisacodyl as well. There is also clarithromycin and ciprofloxacin. They sound alike, and specifically in Australia, where there's a lot of accent, and sometimes with verbal orders, you can hear something that's really different, and then you end up giving that to your patient. These are all the medications that we really want you to familiarize. And there is also the last one here would be the classes of medicines. So cephalosporins, for example, there has been a lot of medication errors around across these medications, cefalexine, cephalothin. Back home, we call it cefalexine, cephalothin. In Australia, we say cefalexin, cefalothin, cefazolin, cefepime. Others say cefepime, cefotaxime, cefoxetine, but they sound alike. You also have other medications such as your SSRI, duloxetine, fluoxetine, paroxetine, all the etenes. And then you've got benzodiazepines, who's, all the PAM, clobazam, clonazepam, diazepam, lorazepam, oxazepam. And if you would look into these medications, benzodiazepines are also Schedule 4 restricted medications. So these are medications that would result to very adverse side effect to your patient if given incorrectly. So you can see there the risk, and therefore it is very important for you during your OSCE for the risk management. Also in your NCLEX, when you look into these medications, there could be situations where the order is a clonazepam and then the nurse has given diazepam. What will be your first action? Okay, this could be some questions about look alike, sound alike medications. So that is the overview of the Tolman lettering. We will share this document. Actually, I can share you the link where you can find this document. But if you search National Tolman Lettering List, and then you type ACSQHC, it will give you the document itself. Or even if you screenshot this concept. So the National Tolman lettering is just one of the very many concepts we said in our previous demo classes, which you can find in YouTube, by the way. We had said that there are 8 concepts in medication safety, and this is one of the 8 concepts. And of course, this is very new to you, and that is the reason why there is an outcome-based assessment, NCLEX and OSCE, because they want to make sure that you actually know these concepts before you enter to the workforce in Australia. So that is the main reason. So let's go through to some case studies of the national of the look-alike, sound-alike medications. And Jacqueline, if you can share your camera, that would be great. Otherwise, your participation is highly appreciated. So as Renu and Kay, Kay, I know that you've been typing your responses. So anyone is, everybody is also welcome to either type the responses or talk. A doctor and a nurse were at the patient's bedside. The doctor spoke about considering Dilaudid, which is a hydromorphone medication. But at the command post, the doctor gave a verbal and written order of morphine. The nurse stated that she did not hear the verbal order and Dilaudid had been given. The patient became lethargic and diaphoretic. All right, so let's look into this problem. What is the nurse trying to understand here? They were considering at that time giving Dilaudid, which is hydromorphone. Is hydromorphone familiar to everybody? Are you familiar with this medication?
No.
No? Yeah, thanks, Jacqueline. Reno, are you familiar with hydromorphone?
It's a kind of narcotics now.
Yeah,
Hydromorphone.
maybe because of the morphone, then we would say it's a narcotic. Kay, are you familiar with this medication, hydromorphone?
Hydromorphone.
And I know you're typing your answer. And while you're typing your answer, we will go into a deeper, we will check this medication deeper. Kay said no. So that is the reason why we're here, because in your OSCE, it might be a medication of hydromorphone. You need to know what is hydromorphone. So hydromorphone is a sound alike of morphine, isn't it? Specifically when you are talking to the team, because in Australia, what happens is that you are always in constant communication with the families and the whole team, not just the doctors, but also with the physiotherapist, dietitian, pharmacist, social worker, everybody in the multidisciplinary team. So when the doctor goes to the patient's bedside, maybe the doctor would say, oh, look, we have considered, I'll consider probably giving hydromorphone to this patient, which is Dilaudid, right? The nurse probably would hear, okay, hydromorphone was considered. Maybe the nurse has checked the order, or maybe has checked the other nurse. What's the order? Oh, morphine. And maybe the nurse heard just the morphone, not even morphine, morphone, and there's hydromorphone, very sound alike medication. Hydromorphone is 5 times more potent than morphine. What does that mean? If you actually give hydromorphone of the same dosage order of a morphine, say for example, morphine 5 milligrams, the nurse has given a medication that is 5 times more potent, more strong than morphine. You're actually giving 25 milligrams of the morphine if you give 5 milligrams of the hydromorphone. 25 milligrams of morphine is fatal. Okay, not just adverse effect, it is fatal. It is a very big dose. 5 milligrams of morphine is something that we can give IV in a very slow push, and that's the maximum IV that we can give to a patient if it is through a push. We can give 100 milligrams of morphine over a 24-hour period via a patient-controlled analgesia, or over a few days. However, we cannot give 25 milligrams of morphine in one go. So therefore, the order here does not say 5 milligrams of morphine. Maybe it's just 1 milligram and ended giving 5 milligrams, because it's 5 times more potent. And so that became, that's the adverse reaction of the patient. The patient became lethargic and diaphoretic. How do you feel about it? Renu?
First, the patient is like having the effect of hydromorphone. So I think we have to prepare for antidote and then monitor the patient by vital signs and everything.
Yeah. Thank you, Renu. How do you feel about this medication error, Jacqueline? And Carla, maybe you want to start writing down your response. Jacqueline, what's your go on this one? How do you feel about this error?
It is quite scary.
Very scary, isn't it?
Yeah.
But we're in it is very scary. We are not scaring you though. What we are trying to emphasize here is that it could lead to life-threatening conditions.
Yeah.
And being a registered nurse is actually a scary job, isn't it?
Yeah.
We are dealing with human beings every day. So this is the reason Why? There is a Tolman lettering. There is a scheduling of medications. So if you would attend our classes, you will know that there are schedules of medicine. There is a scope of practice of registered nurses. What do you do if you're looking into administering a scheduled 8 medication? Okay, so Renu has answered this question. What do you do now? What do you do, Renu?
First, we prepare for, we monitor the patient, vital signs, and we prepare for antidote of
So,
hydro.
sorry, did you say vital signs?
Yep. And respiratory, everything, yeah.
So yes, quick assessment. I'm not sure, Jacqueline, if you're aware of an A to G assessment. Are you familiar?
No.
Not as well. And that's fine because that is the reason why NETA is here to help you, because these are the tools and pathways that we in Australia use. And when you do your OSCE, you'll be using this mnemonics and tools and pathways which we teach our students. Renu, you're familiar with A to G assessment, are you?
Yes,
Yes.
yes.
So, and I would say, yes, you have to be because you have attended the online class. Okay. So the first thing that you need to do is actually do an A to G assessment. This is the bread and butter of registered nurses, is to do an A to G assessment, assess for airway, assess for breathing, assess for circulation, so on and so forth. So what do you do now? Quick vital signs, an A to G assessment. If there is something that you can distinguish a variance, say for example airway, you don't proceed to breathing unless you attended that airway. So if the airway is blocked, clear the airway straight away. Okay, if the breathing is compromised, solve the breathing straight away, probably administer oxygen. Okay, do something within your scope of practice, and that's what you need to do like right now. And that will also come out in NCLEX. And in our NCLEX, Jacqueline, if you're looking into NCLEX first, we do have the NETA decision tool that would actually tell you what would you do first. And it will tell you the prioritization question there, which is 33% of the test would be management of care, which would be prioritization as part of it. So we do have the tools for you so that you will know what you need to do as a registered nurse, because this is what APRA is trying to test you. Do you know how to save a patient who's got a medication error, who's got an adverse reaction from a medication error? So what do you think has led to the error? Why do you think there was an error? Why did the nurse administer Dilaudid or hydromorphone instead of morphine? What could be the factors there?
At first, it was like sound like medicine.
Yes. I'll just put the word LASA, but it's more of a sound alike medication. Yes. What else could have led to the error?
And I think the nurse, the prescription dose of the hydromorphone and the morphine, there is a difference, and the nurse should have a knowledge of the medicine first.
Yes, that's definitely correct. Before administering the medication, it is important for you to check. And in our OSCE classes, we always emphasize the 3 checks at all time. If you fail on the first check, if you fail on the first check and you still fail on the second check, you will never fail on your third check. Therefore, it is very important to apply these 3 checks. And when you join the classes, you will know what are these 3 checks and how to implement these 3 checks and when to implement these 3 checks. What else? What do you think have led to the error? Jacqueline, maybe you have some ideas. Reno, you can also speak out.
And I think it's a hydromorphone acid medicine. So two RNs should check the medicine so that the two RN will validate the dose and the medicine too.
Correct. Thank you very much, Renu. The scope of practice, I really like how you attend the online classes and then now you've got this good knowledge. So the scope of practice, you need to know what is your scope when you administer this schedule medication. So this is a controlled medication, so it's actually a scheduled medication, and these medications, morphine and hydromorphone, are actually scheduled 8 medications, which means that there is a special scope of practice. And Renu just mentioned one of the scope is that there should be 2 checkers, one as the administrator or the one who administers the medication, the other one as a witness. Okay, so we will discuss more about this during the classes. But number 1, the checking of the order, which involves 3 checks. Number 2, knowing what is the medication that you're actually giving. Knowing that it is Dilaudid, which is an S8 medication, the nurse should not administer this on her own. Okay, so maybe the error there was because the nurse did not follow the scope of practice, did not get this medication checked by another nurse. Just imagine 2 checkers in 3 checks. Where can you get the error? There is very small, very tiny chance of making an error with 2 people checking independently and doing 3 checks altogether. There will be very less error. And of course, knowing the scope of practice of the other checker as well. So as you know, there is LPN in NCLEX, we call them LPN, but also EN in Australia, which are alike, and a registered nurse. And they do have different scopes when it comes to the S8 medications. So as a registered nurse then, when you are answering your NCLEX or OSCE, how would you do it differently? What do you need to do when you administer this kind of medication? There's an 8 seconds rule, and they said that I need to wait for 8 seconds before I speak out. I did count 8 seconds, to be honest. So as a registered nurse, in your practice, whether it is for NCLEX, OSCE, or in the real world where you already are registered, you have your registration number in APRA. The first thing is that you need to identify if this medication has a look-alike or a sound-alike medication. Continue to do your checks, know the medication, and know the scope of practice of the nurse administering such medication. And you will have very tiny chances of committing an error. Okay? All right. This will be the second and the last one. A patient's pre-op orders were continued along with the post-op orders which were written. The patient had been ordered Dilaudid IV pre-op and morphine IM post-op. A nurse continued to give Dilaudid IV. The patient developed respiratory distress with decreased level of consciousness. The same kind of medication, but in a different context. So Dilaudid was given pre-op and morphine is ordered post-op. Again, this is a problem of not checking the medication. So hydromorphone and morphine really looks alike in a medication chart. The only difference is there is a word hydro. In some cases where doctors' handwriting are very thin, sometimes hydro is just that much, and then they write morphone, which then, if you are in a hurry, you can only see morphine. Okay, not even the O. Our brain sometimes tells us, even if it's misspelled wrongly, but sometimes our brain just reorganizes those spelling and then we would know what it means. So therefore, again, it is very important for you as a registered nurse to actually check the order, know the scope of practice of an S8 medication, and check it with another nurse at all times. Any questions with that scenario? How do you feel about it? Aside from being scared.
Maybe feel guilty as well, because of your mistake, the patient can have a fatal outcome. So
Yes, and it is very essential that after this medication error, after you have settled the patient, made the patient safe, this will come out in NCLEX. And also very important in OSCE that you mentioned that after a medication error, there should be some debriefing sessions and reflections for the nurses to be able to reflect on what has happened, debrief, to be able to have that good mental state, because sometimes you cannot sleep for days when you have medication error, specifically if it is already in Australia, because the registration body is quite strict. So it is very important for debriefing session and reflection, and that is something that you need to note and let your assessor know, so that they know that you are knowledgeable enough, that you have that uh, you have that knowledge of what it is when there is a medication error. All right. So for the NCLEX and OSCE, Renu, you have experienced this, but for the information of everyone, it is a blended learning. It is self-paced. For NCLEX. There are also self-paced for OSCE. We do have online, live teleconferences, and face-to-face for OSCE, which at the moment, at the time of recording, we have canceled because of the lockdown in Sydney. But definitely we have other face-to-faces going on with no cancellations. Melbourne at this very moment is on their day 4 of their 5 days of face-to-face. So Karen, who is the course coordinator, is running the Melbourne face-to-face with Bing and Anamika, our educators. All of these resources are accessible within 6 months period, and this is part of the terms and conditions. We do have student support. So Faith, who is holding the yellow book, is in the Sydney office, and she does student support and also a nurse educator. And we do have library services. So you can see the number of books. These are the books that we have for OSCE, but definitely we do have books as well for NCLEX. The good thing of NETA is you don't need these books. We have integrated them in the whole program. There are students who are actually tactile learners, and we address all types of learners in NETA. So if you're the person who would love to touch a book, read a book, definitely, by all means, ring the office and request to borrow the books. If you can see where my mouse is at the moment, that is Karen, the course coordinator, and you can see there, and maybe still at the back, there are still other, or you can see there, there are still other books that are available, and these are your NCLEX books as well. So for the NCLEX, you take full control of your learning. There is a mandatory live orientation. However, the rest of the topics are self-paced, and on the other side, you will be joining Wednesday classes, which would be more of question strategies. How will you answer the test if you don't really know the answer? That is the summary of the Wednesday class. Then you need to attend all your mock tests via your learners portal, join the intensive coaching and your polishing session, which is a one-on-one discussion with your educator. Your polishing session is a one-on-one discussion with your educator for some recommendations and some evaluations of what you need to do to be able to pass for your NCLEX, and also completing your readiness program. Your OSCE, you will have a checklist for your OSCE as well, and we provide this to our students. Renu, do you have this checklist? Yeah, Good. So, so your OSCE, you'll have your mandatory orientation, you have your self-paced learning via your learners portal. You have a workbook, and when we say workbook, because it is a book that you need to work on. So these are the things where you need to submit written, written activities or video activities, and you also have your 2 weeks of online classes and face-to-face training, all again accessible for 6 months period. And this is the educators. These are the educators. We are proud of our educators. We're very people focused. We develop our nurses. We just received actually last week, actually it was 2 weeks ago, a text message from one of our students saying that NETA did not only prepare her to pass the test, we actually prepared her for her practice itself. When she attended the interview, the comment of the nurse manager who did conduct the interview was, your answers were for a nurse manager or nurse leader, because we have prepared her with a lot of knowledge and a lot of skills where she was able to take to her career as a registered nurse. So good on her. She found a job in Newcastle, and I need to check on her as well. So when she's commencing, but she's already a registered nurse and she found a job. So that was very good. If you'd like to visit our website and look at our educators, have a brief check on what the experience would be, because I think it's very essential for you to actually know who are teaching you, because you would know as well that they are all credible to be able to teach you. We are all registered nurses in Australia, and 99.9% are all overseas registered nurses who have been in your shoes as well. And again, our main goal is for you to be in the APRA register. So good luck in your studies. Let's connect. This is Roji, by the way, and Roji is a very kind human being. So please give her a call. Do not hesitate to ask questions. Connect with us in our social media pages. We share our lives and stories in Facebook. And so if you follow us in Facebook, we're called NETA OBA or NETA OBA. You can see the lives and experiences of our students and educators in there. We make it as interactive as possible. And also we see our students and our future students interacting in there. Please do not hesitate to send us a message as well in Messenger if that's the easiest way to reach us. And of course, our YouTube videos. This video will actually be uploaded in YouTube for future references of other students who have missed this session. We do have a lot of other sessions applicable for both NCLEX and OSCE in our YouTube page. So please do not forget to go and follow and subscribe. I feel like a blogger anymore. Subscribe to our YouTube channel. All right, guys, thank you so much for today's session. All the best. If you have any further questions, I'm happy to stay for the next 5 to 10 minutes. And I'll just stop the recording. Thank you very much, everyone. Jacqueline, Renu, Kate, do you have any questions?